Shoulder internal rotation, range of motion. Have your subject lie supine with their shoulder abducted to 90 degrees and elbow flexed to 90 degrees. Make sure they stay in neutral pronation and supination. Place a towel underneath the humerus so it is leveled with the acromion and the subject's arm is supported. The axis of rotation is the olecranon process. The stationary arm is an imaginary line perpendicular to the floor. The mobile arm is in line with the ulna, aligned with the ulnar styloid process. Normal range of motion for shoulder internal rotation is 90 degrees. Hip abduction, range of motion. Have your subject lay supine with their legs fully extended straight in neutral rotation. Have your subject abduct one hip by sliding his leg laterally. Watch for any rotation or flexion of the hip. The axis of rotation is over the anterior superior iliac spine. The stationary arm is placed along an imaginary line that extends from one anterior superior iliac spine to the other. The mobile arm is in line with the midline of the femur. Normal range of motion for hip abduction is 45 degrees. Thoracolumbar flexion, fingertip to toe, spine range of motion. Have your subject stand feet hip width apart and legs straight. Instruct your subject to flex forward and try to touch the floor with their fingers. Then measure the distance from their fingertips to the floor. Normal range of motion from fingertip to floor is 0.1 centimeter to 2.2 centimeter. Extensor digitorum foot manual muscle test. Have your subject sit at a table with their legs and feet relaxed, hanging off the table or chair. Instruct your subject to extend their digits 2 through 5 by bringing their toes up as far as they can, pointed towards the ceiling. Allow them to flex their toes. Use one hand to resist the proximal phalanx into flexion and the other to stabilize the foot and ankle. Brachialis manual muscle test. Have your subject sit with their hands rested in their lap. Instruct the subject to flex their elbow 90 degrees. Stabilize the arm on the humerus just proximal to the elbow joint. Apply resistance proximal to the wrist joint. Instruct the subject to not let you push down their arm. Grade 5 is given when the subject can resist your force and gravity. Grade 4 is given when the subject can resist both force and gravity but cheat using other muscles. Grade 3 is given when the subject can flex the elbow 90 degrees without resistance. Obliques manual muscle test. Have your subject lay supine with their legs extended and hands clasped behind their head. Have your subject curl up as far as they can, rotating to one side, bringing the right elbow to the left knee. Test the right external oblique and left internal oblique. While bringing the left elbow to the right knee, test for the left external oblique and right internal oblique. Watch for the elevation height of the scapula. A grade 5 is given if the inferior angles of the scapula are cleared and the hands are above the head. Grade 4 is given if the scapula can be cleared but the arms are crossed in front of the chest. Grade 3 is given if the subject can clear the scapula but the arms are beside them during the test.